The news this hour, the National Association of Nigerian Nurses and Midwives has engaged the Nursing and Midwifery Council of Nigeria over the new guidelines for verification of certificates. They are calling for an immediate reversal and withdrawal of the new circular on certificate verification. Nurses and midwives in the country last week complained about the deactivation of the NMCN verification portal since December 2023. The nurses say the deactivation of the portal by the council is an attempt to stop them from pursuing career opportunities abroad. The NMCN issued a memo dated February the 7th, revising the guidelines for requesting verification of certificates for nurses and midwives. And resident nurse, clinical assessor, Lagos State, Osemeke Dike, joins me for more. Good to have you join us this hour.
Thank you very much, and thank you for having me. Good afternoon.
Good afternoon. So talk to us more about these new guidelines. What does it state? And then why is there so much controversy about it?
All right, thank you very much for having me here. We, the nurses in Lagos, came out today. We are here live in Yaba, the Nursing and Midwifery Council office. We have been making a lot of agitation and making press releases about this circular that was released by the Nursing and Midwifery Council of Nigeria last year. Last year in November, and then the council closed the portal of verification. And just this past week, they released an update about the follow-up for the opening of the portal again. And the implications are, first, let me enlighten you on the content of the circular in just points. It means that the nurses will have to practice for a minimum of 2 years post-study before they are allowed to verify their license. In addition, they need 6 months prior to the license expiration. That means once your license is just 6 months away from expiring, you cannot renew your license. You have to wait. And also, if you apply to renew your license, you have to wait for a period of 6 months. And lastly, this is strange, a newly introduced process that they require a letter of good standing from a CEO who has employed this nurse. So those are the content of this circular. And the nurses are not fine with this circular. We are not happy with it, and it's passing a lot of messages to the nurses. First of all, the nurses are saying we want a total withdrawal of this circular due to its implications. So it implies that nurses will be held back in Nigeria to stay behind without their own willingness, which means that you have a lot of nurses being forced to work here and under conditions that are not good. And also, the intention of this circular also is to ensure that Nigeria has enough nurses. But against the popular claim, Nigerians have enough nurses here, but these nurses do not have employment. We keep writing for employment, we are not getting paid well, bad working conditions. So all of these are factors forcing it. So there are nurses here that do not have jobs. Right. So further, we have people who want to travel for the sake of study, not just to work. They want to study. We have nurses who have traveled to China, getting a PhD in research, and they are back in Nigeria. Yeah, they've held conferences last year with top dignitaries in attendance. They are improving nursing here in Nigeria. We need to travel out to know better, to learn better, to bring better things back to the country. So in just a summary, this circular has some intentions that are not straightforward. And the consequences of this circular, if it continues in the next few years, is that Nigeria will have too many nurses who are not comfortable practicing here due to the conditions. And there will be toxicity in the system. You have nurses who are frustrated, taking care of patients. And this is a risk to public health. You cannot hold people by force in a country. All right, so those are the things we are trying to let you know.
All right, so thank you so much for that explanation. Some people have said that, look, nursing education is subsidized to a very large extent in Nigeria, and perhaps it's only fair that you give the government at least 2 years, seeing that the education has been subsidized before you leave the country. I want to get to your reaction to that. And other people have also said, why not take up the government on some of these issues you have mentioned in terms of, the working conditions, instead of looking to leave the country? How do you react to all of this?
All right. In reaction to this, I can just state categorically that nursing education is not free. If you look at the education of nursing in Nigeria, it's not straightforward. You have different categories. You have the School of Nursing, you have the post-basic nursing school, and you also have the university nursing, which is the DNSC, which you can go through directly with JAM or direct entry. These are the people who pay lesser fees. Regardless, they still spend a lot. You have people in private institutions, the people who come out of the universities are lower in number to those who attend the School of Nursing. And in the School of Nursing, you can do a survey. You pay as much as 500 plus every session. This is not to put into account other practical costs and other related fees. So there is no subsidy anywhere. If you look at the popular claims for scholarships in Nigeria, you will hardly find nursing scholarships. What you see is medicine, you see engineering. And even these people are not still being remunerated properly at the end of the day. So when it comes to nursing studying for free, that is not true. We are paying. We also pay the council for indexing. We pay for licensing. We pay for exam. We pay for verification. Anything we need to do, even renewal, we pay for these things. And it's not small money compared to what we earn. We don't earn enough to even feed this fee back. So it's very, very irrational to say nurses should stay back because they are being subsidized. No, that is not true. That is totally false.
Nurse Osemeke, we'll continue to follow this situation to see how it develops. Thank you so much for your time and for this explanation.
All right, thank you very much.